And let me start by welcoming, I see we have a few attendees, including some familiar names. My name is Davis Patterson, and I'm at the University of Washington School of Medicine. And welcome to our webinar on the microresearch application for technical assistance. And I'm joined by Randy Longenecker at Ohio University Heritage College of Osteopathic Medicine. And Dave Schmitz has just gotten off a flight, and I think he will be aiming to join us later on. So hopefully we'll hear from him too. All right. So let's see here. There we go. I wanted to start by acknowledging that we are funded by HRSA, the Bureau of Health Workforce, and we're grateful for that funding, and also issue this disclaimer that everything that we're presenting are our opinions and okay. The Rural PrEP stands for the Collaborative for Rural Primary Care Research, Education, and Practice. And our mission is to improve and sustain rural health through community engagement and research in primary care health professions education. And I think microresearch sort of brings together those two pieces really well, community engagement and research. And so we conduct our own research projects. We also promote research through this opportunity, for example. We also disseminate research and evidence around rural primary care health professions, education, and training. And then we also aim to build a community of practice in this area. So, and it's a partnership between our three institutions: University of Washington, Ohio University, where Randy Longenecker is, and University of North Dakota, where Dave Schmitz is, plus other partners as well, such as NRHA, NOSOR, et cetera. So I see we've got 5 attendees now. If you have questions, please use the chat box to send those during our webinar. Our slides are, we're not going to go anywhere near an hour. We'll have plenty of time for discussion. And I think too, at the end, we may unmute you all if you want to ask a question directly that way. But if anything comes up during the slides, please use the chat box. And so I will hand it over to Randy to talk about what is microresearch.
Well, hello. I'm Randy Longenecker, family physician and professor at Ohio University Heritage College of Osteopathic Medicine. And I'm the associate director for Rural PrEP and am responsible for leading the microresearch learning community. People hear the word microresearch and they are intrigued. What is microresearch? And it really comes from a group in Canada and Africa who spawned this. Their website is listed there. Next slide. These are the founders from Halifax, Nova Scotia, and also a gentleman from Uganda. And it was really inspired by microfinance. So any of you who are familiar with microfinance and the World Bank of Bangladesh, and how women in that country, for example, were given small amounts of money to begin a business and then to build from there. The idea of microresearch is more about the money than it is about the research. So it's small amounts of money that hopefully can be multiplied in many ways through community engagement. It's enabling funding, not comprehensive funding for a research project. And in Africa, $500 is the amount. In the US, we use $4,000. But our mission, as you heard, is to engage the community in research, and that includes students and residents in primary care, in nurse practitioner education, to PAs and naturopaths and others to engage with the community. And this small amount of funding helps you to accomplish something that has a much bigger impact than you might think. Next slide. Microresearch is now actually integrated into primary care training in Kenya, and we've in fact integrated it into our efforts with students here at Ohio University, offering them this opportunity and encouraging them to participate. In Kenya, the residents lead micro-research teams and engage many people in this effort and end up developing it into a full project thesis. So what we did was we took this micro-research strategy that was used between Canada and Africa, and we adapted it to the United States. Next slide. And this is the funding opportunity that was just announced, and here is the link to that funding opportunity. This is from our website, ruralprep.org, and there's other information there that I will encourage you to explore. Next slide. So our approach is that, or our basic premise is that locally generated and implemented projects are most capable of pursuing local solutions to a local problem. And in small, mostly rural places with a small amount of funding, micro-research can have a big impact. And in the 17 projects we funded so far, we've seen multiple examples of that. Next slide. The deal is that up to $4,000 per grant year is available for awards for a total amount of $30,000 each year. And this is funding in the way of reimbursement. So it's not, you don't get $4,000 to spend as you wish over the year and then tell us at the end of the year how it went. But instead, you have to expend money, send us receipts, and we immediately reimburse you on the basis of the budget that you've given us and on the amount that you've been approved for. We give preference to projects that cross institutions, and we might even fund several institutions who agree to work together. But there needs to be one award lead or project lead at each institution. Next slide. To be eligible for this funding, you need to be one of these three things. You either have to be a current student in a medical school, nurse practitioner, or PA program. And we do have one naturopathic physician student who's been funded. But you have to be a student in those programs because we're focused on primary care. We are, we'll talk about what you might do if you're not one of those three. Residents are also eligible if they're in a rural residency program. And to be a rural residency program, you have to be either located in a rural place for all 3 years of your training, or you have to be in an integrated rural training track where you at least spend 50% of your time in a rural place. And if you want to know if you're rural, just go to MI Rural, type in your address, and you'll find out. You need to meet 2 federal definitions for us to consider you rural. Other health professions training for primary care location in a rural, primary care practice in a rural location. So if a PA, for example, is doing training in a rural location, or a doctor of nursing practice is doing training in a rural location, that also is eligible. Next slide. And if you're not eligible by those criteria, then find somebody who is and partner with them. Partner with an eligible applicant to submit a proposal. The next slide. Eligible topics would be anything really relevant to rural primary health care or rural population health. We're especially interested in finding projects around rural health education and training, or health workforce education and training. So we're interested in medical education or nurse practitioner education research. Most of the topics that we've funded to date are in the first two categories, but we're very interested in the third category as well. Next slide. And here's some examples of projects that we funded. Shared medical appointments. In fact, this was two students, a medical student and a nurse practitioner student who are married to each other, and had the privilege of presenting their project on our rural prep grand rounds. How are rural communities affected by the loss of a physician? We had a student who has done interviews with community members who have experienced the loss of a physician. Syringe program. We even funded an economic study on budget cuts to rural communities in New York State. And barriers and opportunities to transform healthcare for gender minorities in rural communities. So if you're interested in looking at some of the other examples, there were 17 projects we funded. Here's the link to visit those. Next slide. Preference is given to research that is community engaged, particularly if you can demonstrate that by a letter of support or by some in-kind contributions from a community agency. That would be great. And again, we're anxious to support collaborative efforts across health professions or across institutions. Next slide. Each awardee is paired with a faculty member. In most cases, that's someone who they identify as a mentor in their location. But if you don't have a mentor, we'll see that you get one, either one of us, or we have lots of connections and we might connect you with someone else who would be a really good mentor for your particular project. Even if you have a mentor who's officially your partner and advisor, the three of us are available anytime for questions, and we would be happy to help. And we also do that proactively through a quarterly meeting of our learning community, share ideas among each other, sometimes share challenges or particular projects that we've done, and give each other feedback, solve problems together. We do that quarterly in the evening, 9 o'clock Eastern time, which makes it 6 o'clock Pacific time, and I think 4 o'clock Alaska time, I forget. But it's across time zones that we do this kind of sharing, and it's really one of the more fun parts of the micro-research project. With that, I'll turn it over to Davis.
Thank you, Randy. I wanted to just give a little bit more detail on what you should be thinking about as you put together your application. So here's some of the nitty-gritty. So first of all, these are examples of eligible expenses. I think most of the expenses that have been proposed fall into these categories. What I really wanted to point out here is that we do not pay for salary, so that's one expense that you should not include. But you know, all the other things that you need to do to carry out research, sometimes people need supplies if they're doing some kind of small intervention that they're making a part of their research, and then there's a sort of a caveat. There's some technical government information there at that link, and basically tells you in very great detail everything that you may or may not be able to spend money on. It's quite a lengthy thing. If you have any questions, you can also ask us as you're preparing your application. We expect that we'll be making the awards in July, and so that gives you almost a full year to complete the project. And so we want the research itself to be finished within a year or less, and then disseminated in some way at a conference or published within 2 years of getting the award. And another added benefit is if you do get selected to give a podium presentation at a U.S. conference that's regional or national in scope, we will support you up to $1,000 for the travel associated with that, travel and registration. We require quarterly progress reports. They're fairly short, but they're meant as a check for you and for us to kind of get a sense of where you are. And then there's an end of grant year report. So after you finish your year of funding, and then if your research is still going on, you're still wrapping it up, which we want you to finish it in a year. Sometimes things IRB approval is very slow or something, and you end up finishing past that point. Whenever it does get finished, then we'd like a final report on that and with a reflection on the experience. And it's really for you to learn, but it's also for us to learn. Those are really important for us. The application is open, as you probably know, and today is the TA webinar. The deadline for our applications is June 3rd. And on our website, there's full guidance along with, when you click into the application itself, you'll see there's a guidance document, a proposal template that we ask you to use, and a budget template that we also ask you to use that you can download right from the application itself. The proposal template, these are fairly standard things that you need to talk about when you're going to propose some research. What's the background to the study? Do you have a research question or a hypothesis? What is it that you're trying to learn about? And then what are your methods? And I'll say a little bit more about that later, but as much detail as you can provide in the allotted 2 pages. And then what do you expect to do with the information that you generate from your research project? How are you going to disseminate it? Are you going to do presentations, write a report? Do you have a specific conference in mind? That sort of thing. And then really important is a timeline of what you expect to be your major milestones in completing the project, getting it started and getting it finished. The budget template looks like this, and there's rows for you to put all the different expenses. Make sure that everything that you need is included there, and we break this out into what is the amount of funding you're requesting for that particular item from Rural Prep, from us. If you see yourself contributing any personal funds, and you can estimate that. And then if there's any other support, if, for example, you're working on, you've taken a piece of someone else's larger research project and you've added a twist to it, your own idea that you want to pursue, but you're connected to this other project that has, for example, some great data that you're going to use that they're collecting, then, let us know about that, if there's a cost associated and if they're providing that to you in kind or what have you. So we just want to make sure that you've accounted for all the resources that you need here, and that we can understand, what money you need from Rural Prep and how you plan to spend that. And so that last column there, the budget justification, is important. Doesn't have to be lengthy, but just explaining what each expense is, each row you've filled out. And again, we can answer any questions about this if you have it. Once you look at it, please do contact us. I'll also note that expenses must be incurred and submitted for reimbursement by June 20th of the coming year. And that's just because we need time to process it before the end of our grant year, which is the end of June, and get you reimbursed. So I'm just going to wrap up here with a few slides. These are all actually, this checklist is contained in our guidance, but I want to go through it and just say a few more words about it. But we included this checklist. These are some common pitfalls that we saw in the first round of applications that we wanted to try to get ahead of and help you do a better job on your application. So make sure, first of all, that you are an eligible applicant, as Randy laid out who's eligible for this. and we have references to the guidance document there. Also make sure that the community, the population, or the community, or the geography that you're studying actually is rural. It meets the rural criteria contained in the guidance document. And I will say we've had some national studies, for example, survey research where you know, you don't know yet who's going to, it's sort of a snowball approach. You don't yet know yet who's going to be responding. But we presume that you'll find a way to have it reach rural folks that can respond. So you may not be able to exactly specify, you know, this community or that community. But when you can, if you have a specific rural community in mind that you're doing this, then please make sure that it meets the criteria. And we will check that if you haven't. Do you talk about in your proposal, I guess in the background section particularly, what's rural about your topic? You know, if you're doing lead exposure or diabetes, for example, what is the specifically rural angle to it? Because these are problems that also affect urban populations. And so we want to know how you're thinking about this in a way that's rurally relevant. Is your project a research study or is it an evaluation of some sort? And, you know, evaluation uses the tools of research, and so, you know, that's legitimate. But if you're proposing an activity that's just an intervention and it doesn't have a research or evaluation component to it, then that wouldn't be appropriate. So you really need to be generating some new knowledge out of whatever activity you're proposing to do. Does your proposal include a clear timeline? And I think this is an area where people have sometimes just not really given us a clear sense of what the main activities or milestones are. Not all projects require an IRB review, but if yours does, or it may, then make sure that you've budgeted time for that. Is your project of a feasible, appropriate scope? Will you be able to actually do it within a year? You know, we're not looking for an NIH level of a research project proposal. We're looking for something that's very feasible for a very busy student or resident to fit into their calendar in a year. And so just keep that in mind. I think a small but well thought out project is much more fundable and you know, much more desirable than something that's too big. If you have a team and a few folks have proposed, you know, joint projects, you know, then please explain that. You know, explain who's doing this with you. Have you described all the research activities that you plan to do and the reason why you're targeting a particular population? How many folks are you going to interview or survey or will be in whatever data set that you're going to be using to the extent that you know, and an estimate is fine. How are you going to recruit your subjects if you're doing direct recruitment and primary data collection? And here, you know, some people, you know, have proposed studies to access communities that they may not be a part of, and so you need to explain what's your connection to that community. For example, Randy showed the gender minorities, and there's a study about transgender community. Well, if you're not part of that community, how are you going to gain access? How will you collect data from subjects or about subjects? You know, what specifically are they going to be asked to do? And then finally, what are your analyses, and whether that's qualitative or quantitative? And sometimes people think that qualitative, you know, that there aren't really clearly defined methods for analysis, but if you are doing a qualitative study, try to give some description of how you're going to analyze that data. And I'm a qualitative and quantitative researcher, and I will guarantee you that there are methods, no matter what data you have, there are recognized methods for analyzing it. If others are going to be on the team, I was mentioning earlier, make sure that you describe everyone's roles and contributions, including your own. And especially if you do have non-research partners that are part of it that you need, again, to have their participation, like a site that you need to use for your study. Let us know if you've secured an agreement for them to participate or for you to have access. We ask your proposal to be 2 pages, no more than 2 pages. The references can go on a 3rd page. And we have some specific formatting requirements. And this is just a word to the wise for anybody that submits a proposal for anything. Make sure to follow those technical requirements. And the point is for it to be doable for you, but also easy for the reviewer, for us to review it. And you'd be surprised at how many applications we've received that do not respect the 2-page limit. So we're asking you to do that. And this is our contact information for me and Randy. And I see that Dave Schmitz did make it on after his flight. So glad that he's here. And that's our website. And again, do reach out to us or Lindsay Pison, who is also monitoring this webinar. She is our project manager, or the Rural Prep, rprep@uw.edu. I think that's the correct Rural Prep general web or email address. And so now we have time for questions, and you may use the chat box. We have a fairly manageable group online. We can also unmute the 7 of you. I think there's a hand raising utility if we do that. And so we could have a conversation as well. I'm not seeing any questions just yet. But please do either use the chat box or JP, have we unmuted?
I will unmute them. This is Lindsay. I can do that right now.
Oh, Lindsay. Okay, great.
So everyone is allowed to speak. Just have to unmute yourself on your dashboard on Zoom in order to speak.
And keep yourself muted when you're not speaking so we don't have to listen to your dog or anyone else. Just unmute yourself when you want to speak and participate. I'll just say one other thing, and that is that this whole process of micro-research, one of the things that surprised me is how it's a learning experience in itself, just filling out an application and putting together a budget. And you need to be comfortable submitting your application, because we will likely get back with you and ask for more clarity, or we may ask for revisions. That's normal. We've done that a lot the 2 years that we've done this, and that's part of the learning process.
And I will say too that that's why we very much encourage you to reach out to us with questions about your possible topic ideas or any of the technical aspects. We're here for you to consult with.
Someone's asking, how many projects do we fund? And it depends. If you only ask for $250, we could probably fund 50 or more, but it depends on how much people ask for. And we have a process whereby we rank the applicants, fund as many as we can, and then if we find that we don't need all the money, then we accept a few more. So our goal is to try to spend the $30,000 that we have each year.
And on that note, we have 17 funded over 2 cycles. And actually, I think, our average is less than $30,000 for each of those years. So hopefully we'll be able to, use more of the funding I think in our last cycle, we were close to 30,000. So, you know, we think maybe 8 awards. I think that would be probably a low, a floor, not a ceiling.
The other thing that happens if you are awarded an amount, you are then asked to fill out paperwork to become a vendor of Ohio University. What that allows us to do is that allows us to reimburse you directly into your checking account. So although we ask that you incur the expense and you might put it on your credit card, if you get that expense receipt to us, we can generally assure you of a really quick turnaround, anywhere from 5 to 7 days. The other thing I'll say about the learning community is that these quarterly sessions are required. That is, we ask that at least one member of your team, that is the student and their mentor, one or both of them is present on each call, and that you participate in at least 3 of the 4 over the course of the year.
And Randy and Davis, this is Dave. I'll just comment. I think that while required, they're also very valuable. And I think not only for the student and the resident who are participating, but also in my position in North Dakota, working with faculty who are relatively new to some of these research activities, like even filling out an IRB in a certain setting or another setting that's less familiar, or how to do these projects while they're very active in teaching and clinical practice. Doing that in a community of peers, I think, has been really part of the value of this project over the last 2 cycles. And I believe it will be again, and again speaks to that idea of choosing your mentor or your team in a way that is thoughtful to allow that to be most beneficial.
Any other questions? Looks like we've answered everything in the chat box, and I don't see anyone else unmuting themselves. So I think we can probably bring this to a close. If Randy or Dave, if you have any other last comments, I'm glad to see that we've got at least 7 people that are interested in applying, and I'm sure there'll be more. And so we hope that we will see applications from all of you. And again, please feel free to reach out if you have any questions. Randy, Dave, any last thoughts?
Just to let your friends know also, this webinar will be up on our site and accessible to others if they want to watch it.
Thank you very much.
Great, thank you.